Oxygenation and ventilation, many nurses mix these up, but they are distinct physiological processes. You might encounter a patient with a perfect pulse oximetry reading who is actually in acute respiratory failure. Recognizing the subtle differences between these two concepts is critical for ensuring patient safety and selecting the correct clinical intervention. Oxygenation is the passive process of getting oxygen into the blood at the alveolar level for tissue perfusion. Ventilation is the mechanical act of moving air in and out of the lungs to clear carbon dioxide from the body. While they work together, one focuses on gas exchange, while the other acts as the body's bellows system.
A patient can have adequate oxygen levels but poor ventilation, requiring completely different solutions for each issue. If oxygen is low, we typically provide supplemental O2. However, if ventilation fails, we must assist the physical work of breathing using BiPAP or a ventilator. Always target the specific underlying problem to ensure your patient recovers effectively.